Hello, my name is Dr. Melissa Boylan, and I am a family physician and owner of Noretta Family Medicine in Columbia, South Carolina. I've been open for about 11 months, and I'm excited to do DPC in 3 today. So my first question is, what has direct primary care taught me? And I would say direct primary care has taught me a lot, but mainly on 2 different levels. The first level is that direct primary care works. You know, I felt like I wasn't sure if it was going to work. I certainly heard lots of success stories from my peers, but I also had some doubters. And so what the past 11 months has shown me is that not only does direct primary care work, but it's been a wonderful thing for both me and my patients. And secondly, on a more personal level, I've learned that I can do it. I had a lot of fears and concerns about opening a practice. I really didn't know a lot about business, which you'll learn more about in a minute. And it was during a pandemic. But certainly the past 11 months has shown me that I can do it. And you don't have to have every single piece of knowledge about how to run a business right from the beginning, which has been a wonderful thing to learn. So, all right, my second question is, what would you tell your 20-year-old self? And I would tell my 20-year-old self to pay attention. And the reason I say that is because when I was in college at the age of 20, I took a bunch of introductory business classes. I did it hoping that I would become a doctor one day, and knowing that having some business knowledge would be a good thing, you know, in a medical practice in the future. However, I went through residency and decided to join a hospital-owned practice when I graduated. And so I promptly forgot all of my business knowledge. However, here I am now as a business owner, and I keep kicking myself because I feel like it would have been nice to retain some of those nuggets that I learned when I was 20. My third question is, what has been the luckiest thing that has happened to me? And I would say the luckiest thing it actually pertains to my profession. So when I was in college, I took a medical ethics class, which I really enjoyed, and I went to our university's annual medical ethics conference. It was there that I met a doctor from Maryland, and we talked throughout the weekend. And I was in my dorm room on, I think it was a Sunday after the conference was done, and I get a random phone call from him, and he said, "Hey, before I leave, I just feel like I need to stop over and give you something." I said, "Okay." So I met him at the dorm, and he gave me a CD of music, but he also said, "You know, I feel like I need to write you a letter to Georgetown University School of Medicine," which is where he graduated from and where I had applied but not yet gotten in. "And I'm going to write this letter on your behalf." And I said, "Well, gosh, that's really nice. Thank you." Not knowing whether it was really going to help or not. Lo and behold, a couple of months later, I get a phone call from Georgetown, woke me up out of sleep at 8 in the morning, and they said, "We have accepted you." And they told me that one of the reasons they accepted me was because of that letter. And so it was certainly divine intervention. I am eternally grateful for that. And it certainly was a lucky thing that happened to me. So, all right. Well, I hope you all are doing well, and I hope you have a good week. Thanks so much for having me.